Mr. H came into the office because his wife made him do it. There was a guilty movement to his eyes, although he had the typical non-complaining, modest prairie farmer way about him. He said his heartburn problem was getting worse, particularly at night and when he has a second serving of ice cream before the 10 o'clock news. He admitted he had been chewing a bottle or two of Tums a day for several years, but the problem strangely got better about a year ago until recent weeks. Now, solid food like chicken breast wanted to catch on the way down. He admitted he had waited until he got the hay in before coming to the doctor. Well, about 35% of all people have some acid reflux symptoms on a rare occasion, like once a year. But 20%, or about 50 million people in the U.S., suffer from recurring symptoms. They describe half-digested acid food rolling up from the stomach, burning the esophagus, and sometimes into the throat and mouth. Symptoms are generally made worse by big belly obesity, late in the evening food in the gut, caffeine, salt, alcohol, certain arthritis and osteoporosis medicines, tobacco smoke, and sometimes by a stomach infected called H. pylori. And reflux is only made worse, more permanent, and destructive as it continues to occur. The mainstay of therapy starts with avoidance of all those issues listed here, especially less food late in the day. Elevating the head of the bed with books under the bedstead is a powerful and underutilized treatment. Fortunately, there are medicines that can also help. For occasional reflux, over-the-counter Mylanta or Maalox works, and these don't stimulate acid production like Tums, Rolaids, or baking soda does. Fast-acting, as-needed histamine 2 blockers like Ranitidine, the generic version of Zantac, also give quick relief. For persistent symptoms, slower but more powerful proton pump inhibitors, or PPIs, like omeprazole or Prilosec, give a more enduring relief. But please remember, if reflux symptoms are severe enough to require the long-term use of any medicine, talk to your doctor. An underlying infection or a cancer could be the cause. I scheduled Mr. H for an EGD where, under anesthesia, a scope was passed down the throat, esophagus, into the stomach and duodenum. We found a cancer in the lower esophagus. Following surgery, radiation, and some chemotherapy, the malignancy has not returned, and that was years ago. Nowadays, when I see him in the clinic, he seems happy to see me, but it's still only after the farm work is done and only because his wife made him do it.